Hi everyone, welcome back. My name is Hina Mazarudin and I am your Vice President for PAs in Virtual Medicine and Telemedicine. Today I'd like to continue a series that mirrors and complements our educational webinars that we do for our PA students so that we can share and shed some light on real-life examples of how PAs utilize telemedicine in their respective fields. I'd also like to use this opportunity to highlight our amazing members and to serve as an introduction or a networking opportunity so that we can build and connect together. You know that I believe we are stronger together. So without further ado, let's get started. Hi everyone, welcome back. Thanks so much for joining us once again. Today I have a paramedic PA who is going to be joining us. Let me introduce you to Travis. Hi Travis, how are you?
Hey, I'm doing well. Thanks for having me.
Thanks so much for joining us. Travis, can you start by stating your name, how long you've been a PA for, and the area of medicine that you practice in, please?
Sure. So my name's Travis Baker. I'm a PA and have been since 2013. So going on 8 years. Now I work in emergency and critical care medicine.
Awesome. Thank you so much, Travis. Can you tell us about how you incorporate telemedicine into your role, please?
Sure. So telemedicine really has a small role, but we do a little bit of that. I have a very, very unique job right now working with EMS. So my full-time job. So yeah, there's my, I'm actually in uniform. Um, so we use telemedicine some to provide treatment in place for those calling 911 that may be better served outside of the emergency department or the hospital system. So if an ambulance gets on scene and they recognize that this person could be treated without going to the hospital, they'll get a hold of myself or one of our other physician colleagues that I have, and we'll evaluate whether we can treat them. And that's all through telehealth. It's a very new program um, recently.
That's amazing, and that's great that you
Yeah.
get an opportunity to use it in these emergent situations. So that way you can better kind of see if that what get the patient to the right level of care and utilize your resources
Yeah.
accordingly.
Absolutely.
All right, can you tell us a little bit about what you like about telemedicine and what you find to be a challenge, please?
Sure. So again, just being very forthcoming is I have not a ton of experience with it. So I'm just learning. Of course, COVID propelled that, I think probably for everybody. The hardest thing is not having that in-person touch, feel, and really the eyes on the patient. I think that that's very valuable in the long run. So I think telemedicine can be a bridge at times, and there is a use for telemedicine, but we shouldn't let that pendulum swing too far and get away from that human touch and the physical exam. So I think that's some of the challenges with telemedicine. The benefits are it's much easier for me to impact far more patients with telemedicine than as far as my job is. I'm driving around the city. So if an ambulance crew requests me, it may take me 20 minutes or so to drive to the scene, do an evaluation, see the patient, make a treatment plan, and then, another 20, 30 minutes to the next scene. Whereas telemedicine reduces that drive time, or it eliminates the drive time.
Absolutely. So, just like you stated, it has its pros and cons. It definitely allows us to get in touch with our patients a lot sooner and to assess and see what is the appropriate treatment plan. And like you said, there is, just if it needs to be that they actually need to be seen in person for a proper physical exam, an actual hands-on approach, then we can definitely kind of help facilitate that. At the end of the day, it's just a platform.
Yep.
All right. Can you share with us a clinical message or a pearl, a wisdom, something with our PA students and our practicing PAs?
Yeah.
What would that be, please?
Yeah. So I was thinking about this question when you sent it. I think, one of the biggest lessons that I learned a long time ago, and I still try to hold true to this, is believe your patients. If somebody comes with a complaint and you can't figure out what's wrong, sometimes a tincture of time will make those go away, but not always. And if they come back with the same complaint, don't dismiss them. Validate the patient and look harder. It could be a psychiatric diagnosis. We know that there's so much somatization, but I think that we jump to that a little bit too soon sometimes. And you're not going to get in hot water if you just believe people, and you'll be shocked at times how much you may find by just looking harder.
Absolutely. Thank you so much. Goes
Yep.
back to the importance of
Yep.
taking a good history and really kind of, knowing when to dig further.
Yep. Absolutely.
All right. Thank you so much, Travis, for joining us. And thanks everyone for watching. We look forward to connecting with you soon. Take care.
Yep. Bye.
Bye.